Okay, great, thanks. Let me share my screen here. Okay. Well, great. Thank you all for being here. There are a lot of things that I think that could have been asked to speak on which I could claim more expertise than writing specific games, but Jordan and I have been doing this for several years. The credentials we really bring to the talk are both having served for years as reviewers. I was on the NINDS NSDK study section for many years, the section that reviews all the Institute's clinical trials. And in that role, I had the opportunity to read many specific games pages, so I'm familiar with the range of what folks do, and I've seen positive and negative reactions to what folks do. So I've also written quite a few specific games pages for grants, some of which got good reviews and were funded, and more that got poor reviews and were not. So, you know, that's a credential as well, I suppose. So I have no disclosures relevant to this talk. And this should really be one of our shorter webinars in the series, and hopefully we'll have time to answer a lot of questions and stuff at the end. But what we're going to talk about is what makes the specific games page so important. And I think everyone would agree on that specific games pages are really important. I don't really think can be overemphasized, but we're going to talk a little bit about why it's important. And then we'll talk a little bit about what I think make some of the hardest parts of writing a good specific games page. There are a lot of things that make a page hard, and most of them are pretty obvious and are going to be project specific. So there's not a lot we can tell you about that, but there are some common stylistic elements that are hard to achieve but really improve these kinds of pages. Then I'll talk about a proposed structure or template for the page. And that'll be something upon which there's not total agreement, but I'll pitch you my preferred style. And then we'll use the balance of the time to discuss your questions and concerns. And I think we have some links to some specific game examples we can use as well. So the specific games page is really your big chance to make an elevator pitch for your grant that you're proposing. And there's at least 3 really good reasons why this is so important. And the first is that a lot of people are only going to read your specific games page. And that's because of how the NIH review process works. You know, your grant's going to go to a review panel of maybe 20 folks or more, all of whom are ultimately going to vote a score for your application. But, you know, 2 or 3 or 4 will be assigned as primary and secondary reviewers. And then there, you know, some of them will be tertiary and statistical reviewers. But really those 2 people, the primary and secondary reviewers, and probably the other assigned reviewers, they're the only ones who are reliably going to read your entire grant application from snout to tail. And they'll read it thoroughly and they'll understand it, you hope. And they may or may not read your appendices. But more importantly is that the other 15 folks in that study section whose votes are just as important as yours and their score counts are the same, they're going to hear about the grant application in the presentation by the primary and secondary reviewers. And the additional reviewers are going to add comments. There will be a discussion among the whole panel. And typically during that presentation, the other members of the committee will bring up your application on their screen, and maybe they'll have it printed out and they'll start browsing it, maybe for the first time. I mean, they might have previewed it, but a lot of them will start browsing it for the first time since they were assigned other grant applications, and that's what they read in full in preparation for the meeting. And the thing they're mostly going to look at is your specific games page. And that moment is your chance in that room to sell those other 15 plus people on your idea, independently of what the reviewers have said. And that might be all that they read directly from you. They might skim other elements. Different folks do different things. Some may flip to your figures or your methods, but probably everyone's going to read your specific games page for the first time right there. And like I said, although the assigned reviewers may be the only ones who read the application, everyone in the panel votes. And no one's vote counts more than anyone else's vote. So your specific games page is your grant to the majority of the review panel. So this is really your elevator pitch. It's your only chance to talk to most of the reviewers. The next reason that the specific games page is important is related to what this guy says. Now, many years ago, I wouldn't have needed to say who this is. Everyone would have recognized this as Will Rogers. Nowadays, I have to tell people. And Will Rogers is famous for saying many, many things, but one of the things he's famous for saying is that you never get a second chance to make a first impression. And there's no question that that's true about your specific aims page as well. So independent of all these folks who will only read your specific aims page, even your reviewers who you really have to sell to are going to read your specific aims page first. And what we know is that this isn't just homespun wisdom from Will Rogers. Cognitive science has demonstrated that he's absolutely right, and that this is actually how most people think. Most people make decisions in a fast-thinking, snap judgment way. They read something quickly, they look at it, and then they form an opinion. Then they spend whatever additional time they have available reading the rest of your grant, trying to rationalize and justify the decision they've already made. So your chance to get the reviewer hooked, interested, engaged, excited about your project comes from this initial look at your specific aims page. If you get them interested, they'll spend the rest of the time reading your application, looking for reasons to like it and support it. If on their first glance, your specific aims page, they're not interested, they're bored, they're confused, then they'll probably read the rest of your grant application looking for reasons to not approve it and to score it badly. So there's no question that first impression is the hook, it's the key, and it's why you want to spend lots and lots of time on your specific aims page. Oh, I forgot there were animations on it. Oops. Okay. So the third reason is that the specific aims page is important. The third reason that it's important is that it's sort of the page that people are going to read most often as well. And what I mean by that is that what I do as a reviewer, and I think a lot of other reviewers do too, is use the specific aims page as a map for the 12 pages that follow. So as you start getting into the 12 pages of the grant that are really dense, detailed, data-laden, methodologically complex, when you get sort of lost, you say to yourself, what are we even trying to do here? And then I go back to the specific aims page to try to figure out and remind myself exactly what the applicant is saying and how it relates to the question being answered. So if you can provide that map in your specific aims page, if you make it clear there how everything else that you're going to unpack in the next 12 pages relates to that goal, to that purpose, then the reviewer can use that repeatedly to understand where they are in the grant application, to understand what it is that you want them to understand. Additionally, the reviewer is going to go back to your specific aims page when they go to fill out their review on the summary statement form. They have to answer the questions that are, what is the significance, what is the innovation, et cetera. And to the extent that you can give them a clear, concise statement that exactly answers the scoring criteria questions for them, anywhere in the grant application actually, but it's especially good if it's on the specific aims page, then you're making it easier for them to give you a more positive review. If I can find the statement, quote, this is innovative because, then as a reviewer, I can just go and cut and paste that into my review and you've done my day. So one thing that you should always be trying to do on your specific aims page and throughout the grant application is make life easier for your reviewer. A happier reviewer is more likely to give you a happy score. So now I just want to talk a little bit about why it's so hard to write a good specific aims page. Obviously, given what I just said about how important it is, it's clear what's hard. You've got just one page to summarize your whole project and clearly explain all the complexity and nuance that you've spent the last 6 to 12 months trying to get just right. And you want to get it right on that page, and you have to get it clear, and you have to get it detailed, and you have to get it exciting and everything else. So that by itself is incredibly hard. Equally obvious is that the hardest parts are going to be project specific, and I can't, we're going to differ for each of you. So there's really things that are just inherently hard that I can't tell you how to do. But what I can do is emphasize a couple of general concepts that are specifically hard to do when writing. And maybe by recognizing these concepts and making them explicit, the hope is that you'll be able to tackle them head on rather than just subconsciously ignoring them because they're hard. So what I want to talk about is the narrative of the specific aims page, and then provide some specific observations on focus. Okay, so the elevator pitch is really a story. and this is the classic elevator pitch sentence structure that you'll find in any Business 101 class or text. And this sentence structure says, you know, for a certain customer who has a certain need, I've got this product in this category that has some great purpose, unlike anything you have right now. And what that pitch is really a great story too. You got a main character, the target customer, and the target customer has a problem, a crisis, and lo and behold, a hero comes in, and that hero is a product that has certain powers and abilities that are going to save the day, save the world, vanquish the competition, and save the target customer so that she can live happily ever after. So it's a story, and you can think about it in this pitch format, or you can think of it in the classic sense of a narrative arc. So if you've ever taken a creative writing class, or even just a purveyor of popular fiction and movies, you'll usually see this pattern. This is how all stories work, with the exception of David Lynch movies and Kurt Vonnegut novels and Samuel Beckett plays. And it starts out with an exposition that sets the scene, and then something goes wrong, and there's a complication, and the complication gets worse and worse, finally reaching a dramatic crisis, which the hero somehow overcomes, leading to a resolution of the problem and usually a newer and better world. And this can really map out directly to what you write on a specific aims page. So on a specific aims page, you're going to start out with some background. Here's what the problem is or what the disease is. And then there is this specific challenge. And if we could only know this biomarker or that biological mechanism or treat this aspect, then we'd be able to make a big difference. And that leads to an overarching goal of the project, the crisis, and then there's this hero that comes in with a specific solution to answer this problem. And that here, oops, my animation went too far. What was I saying? You're the hero. The hero comes in and leads to the specific solution that's going to answer the problem. And that hero is you. You're the one who's going to come in and save the day with these specific aims, and you're going to vanquish this problem and lead to an impact and innovation in patient care, where wonderful things are going to happen for all these people who were suffering before. And so that's the story you want to tell. And we'll get back to this when we talk about structure. Okay. Focus. So what I want to say about focus is, I think sometimes that can be even harder to get right than the story. Of course, some parts of focus are easy. The specific aims page focuses on the specific aims. If this blue guy here represents the specific aims statement themselves in your application, then it's not hard to tell that he's out of focus, right? If you invest your time and energy wordsmithing to be explicit and precise and crystal clear and eliminate ambiguity and remove barriers to understanding, then oops, my animation's just not working right. Okay, then you'll bring the aims themselves into focus. And I think that everyone would agree with that and would find that pretty doable. This is not going to be the hardest part of focus. Just saying what your aims are and saying them clearly, you should be able to do that. If you're going to do the project, you should be able to do that pretty well. The hardest part about focus, I think, is really that the aims themselves aren't the only part that has to be in focus. There's also the big picture, right? So there's the impact, and the impact has to not only be there, but you have to sell it with enough granularity so that people can really see and believe that. And then there has to be a backstory, and there has to be just enough methodologic detail so that people can start to trust that you'll be able to accomplish this, even on this very, very, very limited page. So ultimately, you need to have every part of this page be in focus, from the statement of the problem to the solution, to your aims, and to the impact. And nothing on the page is a gimme. To make an analogy to photography, you're creating in this a depth of field by carefully balancing your lighting, your shutter speed, your choice of film, and all your resources. The aims themselves have to be the center of your focus, but people have to be able to clearly understand the stuff around it as well. And that's really challenging, and it requires writing and rewriting and rewriting as much as is needed. This is the one page of your grant application that you need to share with others, with colleagues and with friends, folks who work in this area and folks who don't, because the panel won't all be subspecialists in your topic. And frankly, I don't think it hurts to have family and friends who are even lay read it themselves. I mean, this is one page that you want to continue to revise until it's just as good as you can get. And yeah, you really can't, and I can't overemphasize that. So now I'm going to suggest a specific structure for your specific aims page. And a lot of what I've told you so far is subjective, but this part that I'm going to tell you about is purely a matter of opinion, right? So, I mean, if what I told you up to now was a bit of a matter of opinion, this is something where lots of people are going to disagree with me, but this is what I do. And if you look online, you'll find other examples and other templates, but I think this is pretty similar to what you'll find, even though everyone has their own preferences. There's no single correct structure. But roughly speaking, this is the structure that I suggest for a specific aims page. And it really follows that basic structure for an essay that you were taught back in middle school or high school. It's an introduction that's an upside down triangle, a thesis statement that is concise, and then a body, usually in 3 parts, and then a conclusion. So the introduction starts broadly and then narrows to become more and more specific to the topic. I suggest this be about 1/4 of the page. And then the extended thesis statement is your idea, your goal, your purpose. And this is probably 1/4 of a page or even a little less. I mean, it really should be focused. Then the body is actually the specific aims themselves. And that's maybe another 1/4 to 1/3 of a page. And again, I have it bulleted as 3. You don't have to have 3 specific aims. Three is, I think, nice for a lot of studies, but it doesn't have to be. And then the rest of the page is the conclusion triangle that builds from your specific focus to the broader impact. And you want to make sure that you really conclude the specific aims page with that broader impact. Oh, just see, this is the problem when you don't remind yourself of your animations right before. Okay. So the specific aims page is critical. Writing it is challenging, but you want to tell a story, you want to have wide focus, and consider a template. And then I don't know if this link is still good, so we'll have to test it, but this was a link to some examples. And with that, I think I am going to hand it over to Jordan.
Thanks, Robert. So I am a biostatistician, so I'm just going to talk about how a statistician would view this. So how do I advance the slides?
You just tell me.
Okay, can you go to the next slide, Robert? Okay, so from the statistical perspective, most of the time when a statistician is reviewing the grant, they're going to focus mostly on scoring the approach, and some of kind of looking at the significance of the project itself. But I would say, I don't spend a lot of time looking at the preliminary data and things like that, because that's outside of my expertise. And, I assume someone else is going to look at that very closely. So I'm looking at the specific aim page to understand the big picture, the overall significance, and then to understand in a nutshell what it is you're trying to do, what's your design. And then I want to make sure that whatever is stated in that specific aims page is consistent with whatever type of statistical analyses are being proposed. All right, next page, please. So first of all, it helps, looking at that specific aims page helps to understand what is the research question. And the specific aims are typically written in a way where your hypothesis is not a statistical hypothesis so much as what's the scientific hypothesis. Of course, those need to be consistent, but it's what I'm saying is that you wouldn't write out your specific aims to say the null hypothesis is such and such. Now, some people do that, but I find that most people will just write it out scientifically, and then, you know, the statistician will then subsequently translate that to a statistical hypothesis in the statistical analysis section. But again, it's just making sure that they're consistent. Some people will include like an overarching hypothesis of where you see your research going or moving in the future. But you want to be very clear about what you are currently testing or estimating in the current proposal. And this becomes quite tricky when you're doing, you know, early phase trials or middle development trials, where you're obviously your ultimate goal is to demonstrate that, you know, your treatment is beneficial, but you're probably not there yet in the current proposal. You might just be looking at feasibility. You might be looking at some surrogate marker of efficacy. So it becomes very important to very clearly state what the hypothesis is surrounding the current proposal. And you want to state those aims in a form of a testable hypothesis. So you want to allude to what the population is that you're testing, not just, you know, the disease type, but really specifically kind of alluding to the nuances of the population that you're going to be enrolling. And then you want to refer to the groups that you're comparing. So if you're comparing to placebo control, you want to refer to that in your aims. If you're comparing to standard of care, et cetera. And then lastly, you want to include some acknowledgement of what response variable or what you are measuring your outcome, you know, if it's at a certain time point, et cetera. That should all, in my opinion, that should all be part of the aims statement. All right, next slide, please. So very clearly, from the statistical perspective, an understanding of what you're measuring is kind of a critical piece to understanding whether the analysis is appropriate or not. So I would say a lot of times I'll see a lot of grants where it's very confusing what they're measuring, when they're measuring it, and, you know, how that, you know, if it's dichotomized in some way, or if depending on how it's planning to, if it's, you know, changed from baseline, there's all these differences that it could be. So you want to be just very clear about that, so that anybody that's looking at that would know, you know, right away how you've defined your outcome. Another thing I would say, just to try to be cognizant to avoid a lot of jargon, because people who are not in your field are going to be looking at this, and they need to be able to understand it. So that goes as well for being able to, if you're using a construct, just define what that construct is. So if you're using a construct such as, you know, neuroprotective, what does that mean? You know, what in terms of what you're measuring? How have you defined that? Functional independence, what does that mean in terms of what you're measuring? Just very succinctly, it doesn't have to be, you know, a lot. Next slide, please. Okay, yes, as I said, you know, we want those aims to be consistent with the statistical analysis. This is going to be typically the easiest when you're in the phase 3 setting, hardest when you're in, I would say, phase 2, because phase 2 is that space where you're doing more than just looking at tolerability or safety, but you're probably not yet at the point where you're going to be able to use an efficacy, a long-term efficacy outcome. So you usually have a little more of a confusing, I would say confusing a hypothesis at that point. And that in just as an example, if you've I don't know if you talked about the futility design yet in any of these webinars, but those hypotheses statistically are kind of reversed from the traditional. And so it becomes a little awkward sometimes to write that out in terms of your aim. So you just want to make sure that you have, don't go and try to, change them at the 11th hour without giving that to your statistician and saying, hey, I just want to make sure this is still consistent with the analysis plan that we've planned. So for example, if I was to read the aim to determine whether treatment A is as good as treatment B, I'm going to think in my head, okay, this is a non-inferiority study. So I should be able to read the aims and kind of have an idea of what analysis you have proposed. Be careful about not being too vague or stating something that is not something that you can actually test. So for an example of that is if your aim is, I want to demonstrate safety of my drug, and I'm enrolling 100 patients. So the thing to know is that demonstrate is too strong of a word. What does safety mean? How are you testing that? How are you measuring that? And what would be your no-go criteria for safety? What would make you stop? So that needs to be very well defined, and that's really what you should be stating, is all of those decision rules. If you have like a disconnect between what's in the specific aims page and in the statistical analysis, it kind of implies that you haven't maybe collaborated very well with your statistician, and that would be a concern. You just want to make sure that they are in agreement. Next page, please. The last slide I have is just talking about exploratory aims. This is something I see, just a lot of opinions on. There are pros and cons to having like your last aim being an exploratory aim. I was always trained that every aim should have an associated power analysis and analysis plan, and that is just by nature that's going to that's going to be harder to do with an exploratory aim. So that naturally will have slightly lower rigor and reproducibility, etc. Which it's not. I think a lot of people will forgive that and say, well, that's the exploratory aim, and the benefits of what they've proposed are better than we acknowledge that, of course, it's going to have lower power. But I think it's just something to be aware of. You want to, if you do include an exploratory aim, you want it to be very well defined and not sound like, we're just looking at everything under the sun because we have no idea. So it should be as well thought out as can be, so that it's not detracting from the rest of the application. But of course, that's just my opinion. Some people will always want to see an exploratory aim, and then other people will not like them at all. So that's it for the presentation. I think the next thing is just to have folks ask questions, or Robert, I don't know if you want to bring up that Google link that you had and look at some examples.
Well, I think we can start by taking questions, and I will check out whether we can do that or not.
Okay, here's a question. It says, I'm confused about whether these terms are essentially interchangeable: aims, objectives, endpoints, and expected outcomes. So in my opinion, aims and objectives are somewhat interchangeable, and endpoints and outcomes are completely different constructs, but they are also interchangeable. Robert, would you agree with that?
Yeah, I'd agree with that. I mean, I think that specific aims are what you have on the, and just this is just convention, I think, but I typically have specific aims on the specific aims page of the grant application. The grant has specific aims, and the trial protocol usually has a primary objective and secondary objective, and the objectives of the proposal, the objectives of the trial design, are the specific aims usually of the grant application. But I think that they tend to mean the same thing in the context of a grant application versus a protocol.
Although this does say, so expected outcomes. So oftentimes you might see that expected outcomes referring to what the expected outcome is of that aim. So like what you're hypothesizing essentially.
Right. So I think you're right. I mean, outcomes and endpoints are similar to each other, and specific aims and objectives are similar to each other, right? But I don't think that the specific aims are similar to the endpoints, right? The specific aim is the question you're trying to solve, or the problem you're trying to solve. The outcome or the endpoint is the thing that you're measuring, right?
Right. Unless you're talking about, I mean, sometimes people will put expected outcome, not referring to what you're measuring, but referring to essentially what you're hypothesizing.
Yeah, I mean, right, there's the specific purposes. I guess I would avoid, to avoid this confusion, I would avoid talking about like the outcomes of the grant application, right? Like the outcome of this scientific project will be better, ways to care for this patient population, and that is the outcome of the project. But I think that there you're better off using a word like impact, the impact of this grant application on clinical practice, because outcome can mean different things. And I think that to avoid the ambiguity of the word outcome, I guess I would be using outcomes to mean the thing that you measure in the trial, more like an endpoint. I think that's the more common place that people are going to expect you to be talking about outcomes.
Does that answer the question? There was a follow-up there. Hopefully that clarified it, that I don't think the term expected outcomes is standardly applied in the specific aims page, although it could be used to refer to essentially what you're hypothesizing, but it could also be a little confusing terminology wise. So when I think of the word outcomes, I'm thinking of an outcome measure.
That's
Okay.
usually what I'm thinking as well.
Someone else said, Lori, did you want to add anything to that?
No, I didn't, but thanks for asking. I mean, I think it is a little bit confusing, and some of it is just convention and how people write their specific aims, objectives. But I do think that you don't really list your exact outcomes in your aims. It's more, as you said, Jordan, more like a general description. And if there's anything that you can say about all of this, is that there are lots of different viewpoints on this, which brings us to our next question, which is, what are your recommendations for figures in the specific aims page? And I don't know what you all think, but.
So I don't think there's room for figures on the specific aims page. I think that you need every bit of that real estate for what you're explaining. I think that people are going to flip through your next 12 pages looking for figures, and so you can, I think that's where you put your figures. Every now and then there might be a particular reason to make an exception to that, where the words that it takes will actually take more space than the figure. But I think that's very rare.
Yeah, I agree with that. I think people also vary in their understanding of figures. So what might be extremely clear to you is not necessarily going to be clear to someone else. And so to really have that figure crystal clear, I think often you kind of want to have the words explaining it as well. And so then you're talking about, basically taking up even more space.
Yeah, and I think the other risk of figures is that even when you insert them into a digital document now, I mean, some people still print out their print out the grants they're going to review. But even when you don't, sometimes if the print is small in the figure and someone tries to blow it up, you may not have used something that stays in focus, so to speak, as you blow it up, and then it just becomes an annoyance to the reviewer. Last thing you want to do is have your specific aims page annoy the reviewer, right?
Right. That's a definite. Yeah, no, that can be literally a focus problem. Yeah, as opposed to my general. You know, to get back to that previous question, because I thought that usually we get the question about not aims versus objectives, but specific aims versus hypotheses. So I wanted to know if you wanted to touch on, you know, that as well, because sometimes I say the specific aim can be the more general statement of what it is you're trying to do, and then the hypothesis can be the very specific, we're going to exactly measure this and look for this amount of change with this amount of certainty. And I see people mixing that up from time to time. So I don't mind having a specific aim and then a hypothesis, or I think that you can have hypothesis creep where you keep adding too many hypotheses in the specific aims, and I think you want to try to avoid that, because sometimes people use it as a way to not make a decision as to what they want to do, right? So they can't decide what they want to do, so they just keep adding all the different ways of doing it. And I think that's to be avoided. But I don't mind there being a specific hypothesis under a general specific aim, as long as they're not saying the same thing. So what I hate is a general specific aim that says it, and then a hypothesis that just restates the same thing in either the same words or different words, and still doesn't give me the specific thing that's going to be tested. So I don't know that you always need to have, I mean, the specific aim and the hypothesis together on the page. That's not a required format, but if you do, make sure you do it right.
And I would think more you would maybe need that in the setting of, you know, an early development trial where maybe your hypothesis is a little potentially confusing because of the stage of the trial where you are. So you need kind of a more general aim statement to come first to frame it for the reviewer. I could see that. I mean, a phase 3 trial, I think it's going to be very clear cut what you're doing, and I probably would just state your hypothesis.
So the next question is about defining the big picture and trying to be convincing about the impact without saying maybe that you're going to make. I like the reference to world peace. I was just in a leadership program where they talked about that was the goal, world peace. And yeah, that's probably too broad. So one of the question is what level do you focus the quote big impact that you want to put in that first paragraph? I mean, you can say world peace is important and then say what you're going to do to move us towards world peace, but I'm curious what you guys think.
I mean, I would
go ahead.
I mean, I would just say presumably you're designing some phase of clinical trial, right? So maybe if you're doing a phase 1 clinical trial, your big impact would be at the end of the phase 3, how likely would the disease be treated by this, or how many people would be impacted theoretically, or stated in terms of that.
Yeah. So yeah, no, I agree with that. I think I put in a little so definitely you can err in both directions. If you're gonna say, this is gonna cure stroke, it's not, right? So you don't have to claim that. Although I do see people not sell the impact of the work at all very often, and really there's no statement of what you're going to do matters. And now you know, let's be fair. If what you're going to do doesn't matter, then you've got bigger problems than how to write your specific aims page. So you know, you really want to go into this thinking that you are going to make some, you know, demonstrable movement and progress on a question that matters. And if you're really, really, really having a hard time figuring out how to say that, then maybe you should go back and wonder if this is what you really want to be studying. But that being said, I think what you want to say is that you're going to make a good impact on the question that you have to answer, the problem that you're solving. And the problem you're solving isn't stroke, right? So I'd start that where I say you start broadly. You don't have to start as broadly as some people do, right? Stroke is the, you know, third biggest killer, fourth biggest killer in the US, and, you know, affects all these people per year. There's no one on an NINDS review panel that is going to not know that stroke is a big problem. So you don't have to start as broadly as stroke is a big problem. You start with patients with stroke, with hemorrhagic stroke, often need to be on anticoagulants after the recovery, and we don't know when to do that, and anticoagulants can cause people to bleed more and they can cause people to have less effects, and we don't know the right time to start anticoagulants after a hemorrhagic stroke. Yeah, it's a big problem because there's a lot of people in this situation and so forth. But that's the big problem, and if you can make impact on helping clinicians answer that problem, or even helping researchers know what the next step is in answering that problem in an early phase study, that's the impact that you claim. But you have to claim the impact, and you have to, while you can't be overly, most of the people who are worried about being overly grandiose are the people who need to toot their own horn a little bit more, right? The people who are grandiose, and they're not usually worried that they're grandiose. It's usually the people who, and you know, I think that this fits into that middle section of the specific aims page too, where you do want to make it clear that you are well positioned to solve this problem, right? You're not just selling that there's a problem and there's a study to be done, but why you are the person to do it. And you have to be willing to, you know, say that you're the hero, you're the unique person who's stepping into this space to do this, and why we should fund you to answer this question. So don't be too shy. Don't be grandiose, but don't be too shy. You have to convince us that you're worth a lot of money.
Yeah, I think over the years I've heard this said by one of the other PIs. You know, the questions are, who cares and why you, right?
Yeah, no, it's great. That's succinct.
So the next question is about citations. Do you typically include citations in the specific aims page?
No.
Yeah.
Maybe for that broad statement about background, you might need a one or two, but
I mean, I'm sorry, you can, I mean, you're not going to include the citations on the page. If you know, it's going to go in with the rest of your document. And if you have, you know, footnotes to the citation list that, you know, and you start this, I mean, it is the page 1 of your 12-page, of your 13-page document. So, I mean, you can definitely put, you just don't include the actual citation.
Right.
do you want to bring up an example? We've got 15 minutes.
I didn't test that. Let me check.
There's another question that came into the chat. Some people have advised have each aim with a hypothesis, method, expected findings, and impact of the aim. Do you agree that the expected findings and impact should be aim specific?
I think there's a lot of differences in the way people are trained on how to do this. So some, you know, I see it done very differently. And if I would say I wouldn't necessarily do it that way unless that, you know, really makes sense. for you. At least be, I guess, you know, you could consider doing it if you think it strengthens it, but I don't ever like to just follow a goal just for the sake of following it.
Yeah, maybe rather than the impact of each individual aim depends on what you mean by that, I suppose. You know, but at the end, it's helpful. Sometimes it's helpful to say, you know, if, you know, what would be, you can tell me if you agree or disagree, but one thing you can do is you can say, you know, as the result of this, you know, what the next potential steps would be. You know, if you were successful, either the study was positive, you were successful in doing the study, whether it was positive or negative, you know, where would that take you? And sometimes that's helpful to have at the end of the specific aims page, because it tells the reader that you know, maybe you're not going to live happily ever after, but the next thing that you're going to do is you're going to travel to another country, right? Because and which country you travel to will depend on the outcome of your study. I'm just following Rob's storyline.
And also, I would say with the expected findings, to me, that's kind of like, you've told me scientifically what you hypothesize, but of course it could go either way. So you're just kind of restating that to say which way you are thinking it would go, and also kind of a sense of how big of a magnitude perhaps you might expect to see. I guess that's what expected findings would be, I would think.
So the specific aims examples are on the clinical trials methodology website under clinical trials resources.
And I did pull it up too. So
okay.
If you want to share.
But the next question was about why you, and since I don't really mean like you have to list all your support and experience, but like what if there's something unique about where you are or you're about you know, so like you have a big biobank or you have you know, a major imaging center, it's okay to put that in there. You don't want to list everything.
Exactly.
I mean it by that. It's just sort of like, you know, you can even say with the unique resources at, you know, our institution and our previous history. I mean, that's kind of the why you on the specific aims page. I wasn't asking you to put all of the rest of that in there. What you really want on the specific aims page or the specific aim. So I'll let you go ahead, Rob.
Yeah. No, I think you said it well. Well, I mean, you know, everything on the specific aims page is not the full version of what you're putting in there, right? I mean, it's by inherently summarized. So you want to summarize in a sentence or two why you've assembled this team, or you have this access to this diagnostic resource, or a data source, or, you know, but usually it's the team of people that we've assembled, you know, sort of thing. Or
and it might be like, you know, building on the long history of this team's work in this area, blah blah blah, we are doing. So it's not really very detailed. I'm looking here to see if this one has one, and it doesn't so far that I can see.
Okay, I think there's a few. I don't know if there's one that's better in that regard, but I mean, you know, it's why you're well prepared to take it on as well. It can, if you're a junior person, you're not going to be able to say as much. You're going to talk about your environment and why you're well prepared. But I don't know which. I haven't looked at these in a little while, so.
Yeah, these are stylistically very different, which again goes to the question of how exactly you do this. There's not like a completely right way or only way, right? There's multiple ways. I don't know if you want to comment.
I want to comment on this one here, because the specific aim one has all of the elements that I would want to see, which is you're referring to your specific population in a nutshell. You're referring to the question that you're trying to answer, so shortest duration of cooling, that provides maximum treatment effect. And then you're defining as determined by, so you're referencing what you're measuring here. And that to me is the time point of what you're measuring and the actual scale. So that's a very, very informative sentence, but also very, very succinct. It does not tell you what the expected findings are or the impact, though, not within that section. It probably does at the end. The results of this trial will be immediately significant. Yes. And it also is bringing up innovation.
Just to get back to the expected findings, I don't like expected findings.
Well, maybe the question itself is kind of alluding to the expected findings.
Well, exactly. I just it's a sort of a separate talk, but I talk, the things that worry me most about trialists, scientists, the scientists who know the result, the answer to the question that they're setting out to answer, and they're just trying to prove it to other people, always scares me a little bit, right? And expected findings just puts me in mind of that.
Of what we know what it's going to be. Yeah.
We know what it's going to be, and we just need to keep doing the experiment different ways until we get the result that we were expecting, which just drives me nuts from a scientific standpoint. And it's the hardest. They're the hardest collaborators to work with. I find, are the people who are not willing
already
to
know the results.
Yes, and if the trial is negative, it's because the trial was wrong.
The last sentence, the last two sentences there is an example of what we mean when we say you. So here it's talking about the infrastructure and why that's, it's why that's a benefit to this proposal.
Yeah. So for those of you who are on, if you could fill out the evaluation of the webinar, that would be great. We have about 7 more minutes. There's no more questions in the question and answer. If anybody has any last minute questions for Jordan and Rob, this has been great. And again, I'll just say that there are these specific aims examples on the CTMC website under resources. Well, great. Well, we could give everybody back 6 minutes. So time to
Thanks, everybody.
Stretch your legs between Zoom calls. Thank you, Jordan and Rob. As always, was a great webinar. Really appreciate it.
Thanks. Good to see you.
Good
Bye.
to see you too. Bye-bye.
Thank you all so much.